Hi. So, having done the story of one of my unnecessary surgeries, now I want to try and examine a little bit how it might have gone better. Um, so, firstly, I really hope it would have gone better if I'd have walked into that doctor's office or surgery, whatever you want to call it, with an EDS diagnosis. But that wasn't going to happen. Um, and somebody needs to be the first person to point you in the direction of an EDS diagnosis. Sometimes that's going to be the GP with a sort of a collection of joint injuries, joint pains, maybe some other um, symptoms, maybe fainting or something. That was certainly something that happened to me due to POTS, I guess, although it's not really something I've seemed to have suffered with since having a bad episode about 15, 16 years ago. Anyway, so I didn't walk into the office with a diagnosis of EDS, but I would really, really hope that when a doctor is or a surgeon is examining a joint that they're trying to evaluate whether it needs surgery, that they're going to be considering what the function of that joint is. And it really should have been noticed that that joint itself was hypermobile, even if I didn't have generalized hypermobility. Now, I will say I had shoulder surgery a few months later, and that surgeon did notice that my shoulder was hypermobile and actually did check the rest of my joints as well, which is what put me onto the diagnosis of EDS. Um, and I guess you also assume when you go into a surgeon's office that they're going to check for the non-surgical things, because I don't think I expect a GP to be able to assess all those non-surgical things. To be honest, I don't remember my GP examining it. I'd be surprised if he gave me a referral without examining it, so I guess I did. But diagnosing the kind of muscle imbalance I have is quite subtle. And so I think that would need to come from a physiotherapist or the specialist, not the GP. Another question is, did the GP make the right decision? Should he have first referred me to physio, knowing that I'd had this injury, I'd had some physio, it had calmed down, and then it had come back again? So it was obviously something chronic where physio had calmed it down once. Did I need to try physio again for a longer period of time? So I'm really not actually sure, or from the medical perspective and the doctors involved, what went wrong. And so to some extent I have to reflect on myself what went wrong. Um, and that's really hard because I was 20 years old at the time, or 21, but it was my first time seeing a specialist doctor by myself. Obviously, I've been seeing my GP alone for But I've been seeing my GP alone since like before I was 16, so several years. And felt that I'd got on quite well with the two GPs that I'd had in that time, having moved at age 18 for university. Um, so I think one thing I learned there really was I do actually want somebody else at my consultations. Now, I don't think having my mum or dad there would have made a difference. I don't know if they'd have thought of any different questions to ask. Um, but it's still something that since then I really have tried to have somebody with me at as many consultations as I can, and that means there's somebody else hearing the information, somebody else who can think of questions, and I just find that very, very useful. Um, so that's probably the main takeaway tip that I would have. And the other would be, I think he should have done imaging. I know that it was A or B, and one would show an imaging and one wouldn't, but it would have allowed us a chance to have another discussion. It wasn't A, and so could we have looked again closer to see how precisely do these symptoms match B? I really can't imagine any doctor in the US not doing imaging, and to be honest, I don't think any of the few other doctors in the UK would. I mean, this is actually private insurance, as I mentioned, and so I shouldn't even have a copay. So it's not like it would have cost anybody anything other than my time for me to have an MRI. And incidentally, when that knee did flare up many years later, although GPs in the UK aren't typically allowed to directly refer to MRI, they have some ability to refer to imaging. And my GP actually wrote a letter to the imaging, I guess the radiologists they'd call them, at the local hospital. And they actually, with the fact that I had EDS, consented to an MRI of my knee as referred by the GP, which then meant that I had all the information to know what to do next. And rather than having to go via a consultant and then deciding on physio, fortunately I was able to get that imaging done and go straight. Actually, in the end, I didn't do anything. It did actually recover quite well after having been a problem for a couple of years at the point that the GP was doing that. So it's a bit ironic that I never needed extra input because it just seemed to suddenly improve. I think partly it was that I also had a problem with my ankle at that time and improved the ankle, and that also improved the knee. Anyway, that's slightly unrelated. That is my so my takeaway is if you have a suspicion of joint hypermobility and is that something more, get it investigated as soon as possible. I didn't push for that. I don't remember the exact order of the timings. They were around the same time when my shoulder surgeon pointed out that I was hypermobile, although he used the words hyperlax, which when I typed that into Google, I didn't find very much. It took me a little while to realize that hyperlax meant the same as hypermobile. I hadn't come across the term hypermobile. So it took a little bit of time. But I would very much encourage, if you've got any suggestion of hypermobility, first of all, tell the doctor that's assessing your joint, or to be honest, even any other problem, because connective tissue is everywhere. And if there is a connective tissue disorder, even if you haven't yet got a diagnosis, there's things that they might want to watch out for. So I'd flag that with the doctor. I would take somebody else to your consultations with you. And the other thing is, I only had one consultation with the doctor, and I don't think that's enough, really. I feel that to decide to have surgery, you really need two consultations. One to say, here's the imaging, if you have imaging, this is this is my symptoms, have the examination, decide to have surgery, or provisionally to have surgery, and then have another one where you've gone away to think about it and you come back with more questions. And that actually is what I did, although it wasn't the normal pattern when I had hip surgery later. I actually had a date for surgery, and it was several weeks out. Um, I called up and said, look, I've still got more questions. Can we make an appointment? And of course, they were absolutely fine with that. And that reassured me that I was doing the right thing and going for surgery. So yeah, three takeaways. Minimum two discussions with the minimum two discussions with the surgeon. Take somebody with you, and always mention if you have any concerns about hypermobility, and ideally get hypermobility checked out for whether it is actually I can't remember what they call what used to be hypermobility syndrome. They've changed it slightly, but whatever the new name for that is, or if you've got Ehlers-Danlos syndrome, hypermobility type, or maybe even classic type, but joint hypermobility isn't restricted to the hypermobility type. Yeah, so get all the facts there. And good luck with making smart choices about your surgeries. Thank you. Nice to see you. Over and out.